Hello, I'm Joan Justice from HealthWorks Collective, and I'm here with David-Michel Davies of Webby Award fame. David's here today to tell us about some great tools on the web that can help empower patients to manage their own health. David, tell us about your star picks for web tools that are helping in the public health arena.
Oh, thanks so much for having me. What are my star picks? One of the ones I'm very fond of is something called SymCat. And it's essentially, there's a lot of places online where you can go and type in your symptoms, Google being one of them, obviously, and get lots of information from various sources of varying credibility as well as to what you may or may not have. Lots of people, I'm sure, have typed in that they have a stuffy nose in Google or some sort of ailment in Google and found themselves at Yahoo Answers and with a lot of random people telling them what they think they have. And that's, not a terrible place to start for some general information from lots of people. But what I really love about SymCat is it's all data-based. And so what SymCat does is they actually compiled hundreds of thousands of medical records from around the country, and the type of ailments and symptoms that the doctors had recorded in those medical records, and then eventually the diagnosis of those patients. And so, for instance, I think when the last time I actually had to use it seriously, I had some numbness in my thumb, and so I went and I typed in numbness in thumb numb or something like that, and it compared that and asked me a few other questions like how old I was and if I was a man or a woman and some basic things, and then it compared that symptom to all the other medical records it had in its database and told me which percentage of people who had that symptom also had other diagnoses. And so I think for that it turned out that there was like 15% was something called fibromyalgia, which I didn't have, thank God. And I think another 15% was like stress, and there's some other examples. And so the interesting thing about it is that it gives you it's not trying to guess your diagnosis based on like keywords. It's just taking the symptoms that you have and comparing them to lots and lots of medical records where there has already been an outcome. So it's a very data-driven response. And it doesn't necessarily mean that you have, just because one is 15% and the other one is 10%, that you have the 15% one. But it gives you a sense of the type of diagnoses that people who had your same symptoms did have, and which percentage of people had those. And I think it's a really nice jumping off point.
That's cool.
And gives you a lot of, like I said, data-driven information.
Yeah, that's great. Okay, tell us
another
about
one
Cure
I'm
Together.
very fond of is something called Cure Together. And it's it's similar in that it's also data driven, but in this case it's all about bringing data together from patients who may have the same ailment as you, and it can be anything as simple as fatigue to a serious cancer. And so you go to the site and you sign up and you put in what you are experiencing, what your ailment is. In some cases, it might be a diagnosis. It might be somebody who has breast cancer, or in some other cases, it might be that you feel like you have chronic fatigue. You put that in, and you find other people who have had that same ailment, and those people have already gone through and answered a lot of questions about the ailment they had and the treatments that they had for it, and whether those treatments were successful or not. So for somebody who is potentially going into the beginning of something that's a serious or more serious than a sort of normal daily condition like a cancer, you can go there and find other people who have had that similar type of cancer. You can find out the treatments that they have, and you can find out whether they were effective or not. And it really does a nice job of graphing and giving you all this information visually, so it's easy to see which were the most popular types of treatments based on the condition and which were the most effective.
That's really helpful. That's great.
Yeah, so we love that. We don't love cancer, but we do love the internet being able to connect people who have some of these similar issues and be able to sort of share data and information around them. And the thing I like about both of those is that in the past that was something that was entirely mediated by a doctor, and doctors are great at giving us that information, but they don't always have the amount of time that we would like to spend with them. So this is a nice additional. You can spend as much time as you want in these places. The third one I like is not so much around disease or sickness, but it's about fitness, and it's part of a guide that we did recently about helping people realize their New Year's resolutions. And it's called 5K Runner. And a lot of people, obviously, one of the biggest, I think the top 2 or 3 resolutions is, getting more fit, getting more healthy. And what we found in reading through lots of blog posts and feedback from people on the internet about who succeeded or didn't succeed with their resolutions is that they often start off well, but they're unable to sustain the resolution. And so in this case, it's an app that just helps you get from your couch to running 5K or about 3 miles in 2 months. And the way it does this is it takes you through a gradual, it sort of gradually escalates. So the first day, you put the app on and you go out and you listen to music and your earphones on, and it just has you run for a minute, and then it tells you to stop and walk for a minute and run for another 30 seconds and stop and walk and stop and so forth. And so it's totally achievable. And you finish that first day thinking like, all right, I did it, I made it. And then the next day, it's you run for a minute and 30 seconds and so forth. And eventually you're running 5K after 2 months of doing that. And it's really eased you into that. So I think that what we've seen is that it's more successful because it eases people, it gives people individual successes every day. And it sort of ramps them up into eventually, having a fairly fit type of lifestyle. So those are 3 that we really like and, think that people can really use sort of immediately. I hope that nobody has serious diseases, but if they do, they can use some of those. And if it's just a question of trying to get fit and exercise better, I think a 5K run is a great place to start.
Yeah, I love the 5K run. Well, thank you so much, David. I'm sure our readers appreciate learning firsthand what are some of your top picks in the way of public health web tools. Thanks so much.
Thank you.